There are over 1 billion people with disabilities worldwide. They face marginalization, discrimination, and barriers in accessing essential services, even in normal circumstances. Many of these issues will become even more acute during the COVID-19 pandemic. Governments must urgently ensure that their response to the COVID-19 pandemic is inclusive of people with disabilities. Information about the pandemic and protection measures should be produced in a variety of formats accessible for people with different types of disabilities and distributed widely. With school closures, online learning, and other methods to continue education should be inclusive of children with different types of disabilities. People with disabilities often rely on community services for food, medicine, and support in the tasks of daily living. Government should ensure continuity of these services. Without them, people with disabilities may be at risk of being forced into institutions. In institutions, people with disabilities are at particular risk of COVID-19 infection due to their close proximity with others, often in overcrowded and unhygienic conditions where access to healthcare is already poor. COVID-19 could be particularly catastrophic in refugee camps and displaced person camps, where people with disabilities already face significant obstacles to water, shelter, sanitation, and medical care. One of the most important things that governments can do right now is to consult with people with disabilities in how to ensure that the COVID-19 response is inclusive and people with disabilities are not left behind.